everyone. So I welcome you all to this FB Live by CBCC Cancer Center Agartala. So I hope all of you are safe and sound and doing well. So today, as we know, our topic of discussion is questions about lung cancer. So for that, to answer our queries and questions, we have an expert with us, Dr. Pavan Karella. Dr. Pavan Karela is a consultant surgical oncology at CBCC Cancer Center, Agartala, a center that provides 24 by 7 cancer care in the state of Tripura. Dr. Pavan has done MCH surgical oncology from GCRI Gujarat. He has done his fellowship in minimally invasive and robotic colorectal surgery from Severin Hospital, Yonsei University, Seoul, South Korea. His area of expertise are head and neck oncology, gynecological oncology, and all other onco cases except for neuro. So I take a privilege to welcome Dr. Pavan Karela. Welcome, doctor. We are glad to have you.
Hi, good afternoon. Thank you for the welcoming note. I am Dr. Pavan, surgical oncologist working in CBCC Agatala. Uh, Today, we are going to discuss briefly about lung cancer. Uh, the topic lung cancer came to note of discussion because of August 1st is celebrated as World Lung Cancer Day, and this day is particularly dedicated to create lung cancer awareness and awareness about lung cancer screening and its treatment to the population. So coming to lung cancer,
So,
if we
doctor,
discuss about
Mike,
this,
yeah, yeah, you can go ahead. Yeah, please.
if we come to cancer, there are around 2 crore of cases every year in the worldwide. The incidence of cancer is 2 crore of cases worldwide. Particularly in India, it is up to 22 lakhs of people are affected every year due to cancer. Uh, the thing is, the overall mortality rate worldwide for any cancer is 50% on an average, but in India, the mortality average is 80%. So there is a lot of uh, way we have to go ahead to treat the cancers, to bring down the mortality rate, to create the awareness about the cancers to the Indian population, and to create awareness about the screening for cancers, particularly lung cancer. Uh, Approximately 72,000 of population every year are affected in India by lung cancer. As we discussed, the mortality rate for lung cancer in India is especially more than 85%. So, if 100 people are affected by lung cancer in a year, 85 people will succumb to mortality, succumb to death eventually. This The main reason for this high mortality rate is getting proper cancer care only after advanced stage, like in stage 4 disease, stage 4. But um, recognizing lung cancers in early stages like stage 1, stage 2, and stage 3 can increase the 5-year survival rate enormously. The overall average mortality rate for lung cancer worldwide is around 25%, but particularly in India, the overall 5-year survival rate is only 10%.
Okay.
So, with
So,
this introduction, I
awareness.
think
Hmm,
yes,
yeah. So, I was just saying that awareness is the main problem,
yes,
I feel.
awareness
Yeah.
is the main problem.
And for the same reason, we are doing this live so that people get aware about lung cancer. So, doctor, can we move forward to
Yes,
questions?
exactly. We can.
Yeah. So, my first question to you is what is lung cancer?
Lung cancer is one of the cancers affected in a human body, but this lung cancer is especially Approximately around 1 in every 50 people of Indian males are affected with lung cancer. Particularly, there are few risk factors which can cause lung cancer, like especially the main important risk factor is smoking. Smoking is the main risk factor. More like around 90% of the people whoever is smoking will succumb to lung cancer by the end of like 80 years of their lifetime. But with the lack of awareness, this population are unable to recognize the lung cancer at the right time and unable to get a proper treatment at the right time. There is high mortality rate. So with creating awareness and increasing awareness about the screening of lung cancer, increase the we can decrease the mortality rate, and we increase the lung cancer specific care for the patient.
So, doctor, as you told us that smoking is the reason, so the people who smoke are at the higher risk. So, apart from smokers, who all are at risk for developing lung cancer?
Main reason for lung cancers are for smoking. 20 years back, lung cancers were primarily affected to only smokers. But nowadays, due to increasing the air pollution and increasing second-hand smoking, around only 50% of lung cancers contribute to the smoking, and other 50% lung cancers contribute to the second-hand smoking, either from smoking from nearby people or cooking, air pollution, family history. If any person is affected, any first degree relative is affected in the family because of lung cancers, there is 2 times high risk for the first degree relative of that lung cancer patient to develop lung lung cancer in his lifetime. Apart from that, there is if there is a radiation exposure from environmental radiation, like from radon exposure, any history of radiation therapy for like breast cancers, lymphoma cases, and increased number of imaging tests like computer tomography, CT scan. So these are the main risk factors affecting the people.
Mhm. So, doctor, what are the symptoms if we are exposed to these activities or things? So, what are the symptoms that we or the person who can get lung cancer can develop?
Detecting these lung cancers at early stage will improve patients' rate of getting treatment, curative treatment. The
Mhm.
initial symptoms they may recognize with lung cancer, like cough which is not decreasing over the past 1 week or 2 weeks, having chest pain, having shortness of breath, difficulty in breathing, dyspnea on exertion, any hemoptysis, coughing blood during cough, like any bone pain, any patient with headache, vomitings, which are metastatic symptoms in advanced diseases, are the main symptoms that can be recognized by any person. And if these are not cured with normal medication or with any doctor treatment, they should consult a oncologist for proper approach of the disease.
Okay. So, doctor, my next question to you is: are there any prevention measures, or is there any way to prevent lung cancer?
There is no sure way to prevent lung cancer, but the things like
Mhm.
quitting smoking if they are smoking,
Mhm.
to avoid second-hand smoke from other persons, or like cooking,
Mhm.
avoiding air pollution areas, not starting smoking, eating healthy diet with at least one serving per day with vegetables and fruits, and exercising around 30 minutes per day or 150 minutes in a week will help us to decrease the chance of getting lung cancers.
Mhm. Okay. So, doctor, my next question to you is who should get screened for lung cancer?
There are American Cancer Society has provided us guidelines to move ahead with lung cancer screening. There are a lot of
Mhm.
randomized control trials conducted previously to detect the high risk people who will be affected with lung cancers. Any person between the age 50 to 80 years with history of 20 pack years smoking, with any active smoking, or any person quitted smoking below 15 years should be screened for lung cancers. Especially when we discuss about 20 pack years, it is like if any person is consuming 10 packs of cigarettes per day,
Mhm.
and if he consumes 10 packs of cigarettes per day for 2 years, he will be in the high risk category as he had crossed the limit of 20 pack years. Or any person who is smoking one cigar packet per day for about 20 years of duration will be in this high risk group and he should be screened. And the screening will be done by low dose computer tomography scan, which gives way less radiation when compared to conventional CT scan, which is approximately 90% less radiation when compared to conventional CT scan. The other modalities are like chest X-ray and sputum cytology are there, but the sensitivity of these tests is way less, and uh, we should not recommend chest X-ray and sputum cytology for screening. We should go for low dose computer tomography screening for this high risk of patients.
So, doctor, this is the follow-up question. So, are there any other type of screenings apart from the two that you have mentioned?
No, the proven one is low density computed tomography, LDCT. We call it LDCT,
Mhm.
low dose CT scan. Apart from that,
Mhm.
no other sensitive investigation is available.
Mhm.
So any
Okay.
person falling into this high risk group, as we discussed, should go for low dose CT scan, or if should consult a specialist oncologist for further treatment.
So, doctor, my next question is, as we know, there are stages in cancers. So, are there
Yes.
any stages or different type of stages in lung cancer?
Yes, obviously. For any most of the cancers, there are like four stages: stage one, stage two, stage three, and stage four. Similarly, for lung cancer, there are four stages. Before that, I would like to discuss the types of lung cancers. The most common type is non-NSCLC. The other type is SCLC, small cell lung cancer. 85% of the cases are NSCLC, and these cancers include like adenocarcinoma, large cell carcinoma, squamous cell carcinoma. Other types are small cell lung cancers. Coming to the staging, if any tumor in the lung is less than the T1 size, that is approximately 4 centimeters,
Mm-hmm.
we can call it as T1 tumor. And depending on the size of the tumor, we had divided the staging into stage 1, 2, 3, and 4, and depending on the regional spread to nodes, we will divide the diseases.
Mm-hmm.
Especially if we come the localized disease will come under T1, which is curable with surgical resection. Coming to stage 3 and stage 3, these are regional diseases which from which the cancer had spread to the regional lymph nodes surrounding the lungs. So these are also curable. So if any cancer, we can detect any cancer in stage 1, 2, and 3, they can be cured. But if we catch the patient in fourth stage, that is with distant metastasis, That means the cancer is spread to other organs of the body like brain, bone, liver, and other organs. If we catch the patients in this stage, the survival rate is very less. For example, the overall survival rate for lung cancer is approximately 20%, 5 year survival rate. But when we come to stage wise survival rate, for stage 1 it is 65% survival rate. That means out of 100 people with lung cancer, 65% of people will survive till the end of 5 years if he had taken proper treatment. And similarly, in stage 2 and stage 3, if the patient had taken proper treatment, 37% of people will be alive at the end of 5 years. But if you catch the disease in stage 4 with distant metastasis, only 7 to 8% people will be alive at the end of 5 years. That is, out of 100, only 7 or 8% will be alive at the end of 5 years, which is not at all good. So, detecting cancers in early stages, or at least in stage 2 or stage 3, will provide curative treatment for the patient, whereas in stage 4 disease, the patient will be for palliative care or supportive care depending on his performance status, for which we, rather than surgery, we will go for chemotherapy or targeted therapy, immunotherapy, depending on the patient's genetic status and the disease aggressiveness and disease mutations.
So, doctor, we have talked about diagnosis and the importance of early detection.
Yes,
Now,
exactly.
can you please let us know what are the treatment options for lung cancer?
So, the overall we have three treatment options for lung cancer. They are surgery, chemotherapy, and radiotherapy. Coming to first, we will discuss surgery because surgery is the only curative treatment that can be provided to a lung cancer patient. So, coming to surgery, uh, if a patient is affected with lung cancer presented within stage 1 or stage 2, we can directly go ahead with surgery after in, nodal evaluation. In surgery, there are many types of surgery that can be done for lung cancers. Open surgeries and VATS, video assisted thoracoscopic surgery, and robotic surgeries. Especially when we speak about open surgeries, in open surgeries, we will remove a particular part of the lung. For any lung, if it is right sided or left sided, there are two, two to three parts, we call them as lobes of lungs. In the particular lobe which is affected by cancer will be removed during surgery, which we call a lobectomy. So after lobectomy, we also remove lymph nodes surrounding the hilum of the lungs and the mediastinal regions. So in open surgery, lobectomy is curative option rather than going for wide local excision or wedge resection. And when coming to VATS, video assisted thoracoscopic surgery, this can be called as keyhole surgery. The surgery will be similar. We will do lobectomy and we will go for regional lymphadenectomy of mediastinal and hilar region. And the other thing is the other surgeries available today are robotic surgeries. So we'll robotic lobectomies and or robotic pneumonectomies are the surgeries done for lung cancers depending on the stage of the disease. If only one lobe of the lung is involved, we will go for lobectomy. If two lobes are involved, we can go for bilobectomy, or if needed, if the lesion is central involving main bronchi, there may be a need for pneumonectomy, whether it is open, warts, or robotic surgery. Coming to chemotherapy. Chemotherapy
Mhm.
can be given as adjuvant therapy after surgery
Mhm.
to have regional and systemic control of the disease, which will prevent a recurrence of the disease, which increases overall survival, disease-free survival for the patient. Um,
Mhm.
and can be given as chemotherapy can be given as neoadjuvant therapy, which will be given before surgery, either along with radiation or chemotherapy alone.
Okay.
Before surgery, giving chemotherapy will control the disease systemically and
Mhm.
regionally, and will
Mhm.
downsize the size of the tumor,
Mhm.
which will be beneficial for the patient.
Mhm.
So, apart from um,
Mhm.
chemotherapy in stage 1, stage 2, and stage 3,
Mhm.
there is role of chemotherapy in stage 4 lung cancers. In stage 4, as surgery is not curative option, chemotherapy will prolong the life of the patient, will prolong the DFS, increase the overall survival of the patient, will alleviate the symptoms, whatever they have, like metastatic symptoms.
Mhm.
Depending on the genetic analysis of the tumor, whether there are mutations in EGFR, KRAS, ALK, and other genes, we can go for, depending on the patient condition and affordability, we can go for targeted therapy and immunotherapy along with conventional chemotherapy. And the other role of chemotherapy will be along with radiation. We call it
Mhm.
as chemoradiotherapy or concurrent chemoradiation. This concurrent chemoradiation can be given before surgery
Mhm.
for curative reasons, after the
Mhm.
surgery as adjuvant therapy,
Mhm.
depending on the disease.
Mhm.
And especially during in stage 4 disease, to control the metastatic symptoms, we, we can go along with radiation.
Mhm.
And coming to radiation therapy, this radiation therapy, as we discussed, can be
Mhm.
given as concurrent chemoradiation along with chemotherapy. After the surgery, we call it as adjuvant therapy, and before the surgery, we call it as neoadjuvant therapy. This is particularly to get control of the disease regionally
Mhm.
rather than systemically, and to
Mhm.
downgrade the size of the tumor, which will increase the curative options for the patients.
Mhm.
This radiation can be used in distant metastasis patients, especially to control bone pain or any brain metastasis, to decrease the to control the disease in the brain. Radiation therapy will come into role.
So,
This
doctor,
completely.
when we talk of cancer, there are so many prevailing myths. So, when it comes to lung cancer, are there any myths?
Yes, of course, there are particularly many myths revolving around, but
Mhm.
most important of them are like the first myth is lung cancer will be affected only in smokers. That is the first myth, which is the main reason that can cause cancers. As we discussed, lung cancers will only 50% of the lung cancers are detected in smokers. Rest of the 50% are detected in patients, in persons with other risk factors like secondhand smoking, whoever is subjected to excessive air pollution, whoever is subjected to radiotherapy or excessive imaging tests, having family history in first degree relative, whoever has occupational exposure to like arsenic, nickel,
Mhm.
etc. So the thing is, the lung cancer is not only affected by smoking. It can also occur in any person who ever have other risk factors apart from smoking.
Mhm.
Second myth that is revolving around is, if a patient have lung cancer, There is no need of stopping lung cancer. Either way, we are affected. So, stopping smoking will not improve our life. That is a myth. The reason why I am saying is this: after, if you have detected lung cancer in any stage, stop. You should stop smoking immediately. Stopping smoking will increase your curative options, your recovery from the treatment, your general condition during the treatment. This stopping the smoking will definitely help the patients, lung cancer patients, whoever are already affected. The third myth is like any patient whoever is diagnosed with lung cancer, they should not be neglected. There is a common myth running around is that detecting a lung cancer in advanced stage will not cure the disease. But as we see nowadays, the most of the lung cancers are detected in advanced stages like stage 2, stage 3, and stage 4. If the patient can be detected in stage 2 or stage 3, curative options are always available for lung cancer patients. This the only even if the patient is detected in stage 4, then also we can give appropriate treatment for the patient to increase the overall survival of the patient, to relieve the symptoms, to increase his survival rate, 5-year survival.
Thank you so much, Doctor. So I think I'm done with my set of questions. So let's see what our viewers have to ask.
Okay.
Okay. So first question I can see here is from Hiral Shah. She is asking, will lung cancer surgery affect the ability to breathe in daily life?
Not at all, because we have any person will have two lungs. On the right side we have right lung, and left side left lung, and each lung will have uh, lobes in the lung, as we discussed. On the right side we have three lobes: upper lobe, middle lobe, and lower lobe. On the left side we have two lobes: upper lobe and lower lobe. During surgery, lung cancer surgery, we remove only a particular part of the lung. Like we will do upper lobectomy or lower lobectomy or middle lobectomy, depending on the location of the tumor. Ev- But few patients may need pneumonectomy to clear the disease. Even after pneumonectomy, they may have slight breathing problem, but any patient will improve with time, can live with even single lung without any difficulty. Yes.
Okay. Yeah. Next question is from Rajashekharan Raman. He is asking what all can be a basic symptom to know and identify lung cancer. So he's asking for the symptoms.
As we discussed, the main uh, symptoms from which we can detect lung cancers will be chronic cough which is not alleviating with normal medication, which is persisting like even more than 1 week, 2 weeks. Patient having shortness of breath. I mean, having breathlessness while doing work or even at rest. Dyspnea on exertion, breathlessness during any moderately heavy work, moderate work, etc. Any patient having pleuritic chest pain, that is sharp chest pain, which any person who is having chest tightness during breathing, and any person who is coughing blood during cough should be screened for lung cancer. And any patient with symptoms like any distant metastatic symptoms like bone pain, headache, vomitings, uh, etc. The main symptoms, as we discussed, are we should remember chronic cough, chest
Mm-hmm.
pain,
Mm-hmm.
breathlessness.
Mm-hmm.
These are the main symptoms for which patient should consult a specialist
Mm-hmm.
in view of lung cancer.
Next question we have is from Nikita Banik. She's asking whether surgery is possible in stage 3 of lung cancer.
This is like in stage 3 also, depending on the spread of the tumor, surgery is possible. If the disease is involving one or two lobes of the lung with regional lymph nodes, which will come under stage 3A, it is possible to undergo surgery, but only after uh, neoadjuvant therapy, which can be like chemotherapy, neoadjuvant chemotherapy, or neoadjuvant chemoradiation.
Next is Pragya Khanna. She is asking, can lung cancer be fully cured?
Yes, a lung cancer can be cured from stage 1, stage 2 to till stage 3. We can cure lung cancer. Uh, a lack of awareness in the people will delay the diagnosis of the disease, uh, through which patients will pass through the rough stage, and they will fall into the category of palliative care, and they will succumb to advanced disease and metastatic disease stage of the disease.
Next we have is Dr. Sagar Das's question. He is asking what will be the risk percentage of chances of getting lung cancer by genetic factors?
Any person having a first degree relative affected by lung cancer, there is two times more risk of having the lung cancer when compared to the other person who doesn't have the same family history. So, if for example the any normal person, there are chances like around 10 to 15% of incidence of lung cancer throughout his life. When compared to that person, a person who has lung cancer patient as first degree relative will have up to 20 to 30% of risk of having lung cancer due to this genetic condition.
Next we have is Sebika Dhar. She's asking what are the screening methods for high risk patients of lung cancer?
As we discussed, a
Mm-hmm.
patient, um, any person between the age group of 50 to 80 years with history of 20 pack years, with active smoking, or if he quit smoking below 15 years, should be subjected to the lung cancer screening. The sensitive method available today is low dose computer tomography scan, LDCT. The false positive rate of this LDCT is 20%, but subjecting the depending on the symptoms and uh, status of the patient, repeating the other diagnostic modality, if he comes positive in LDCT, will decrease the false positive chances.
Next question I can see is of Manoj Banik. He's asking, as a chronic smoker, what is the possibility of having lung cancer at the age of 32?
Lung cancer can be affected in any age. Okay, that will depend upon the smoking habit. For any person who ever crosses 20 pack years, maybe consuming 20 packs of cigarettes per day for 1 year, will also put him in the high risk group that he can be uh, having lung cancer. But any person who had consumed around one cigarette pack per day for about the period of 20 years will put him at the risk of lung cancer. So the age will not be the deciding factor. The deciding factor will be the smoking habit and whether it is active smoking or passive smoking and uh, other risk factors as we discussed, uh, family history or other exposure to radiation or history of any radiation therapy.
Okay. Next is, I think, Mr. Ashish Ghosh. He is asking, how long does it take to get better after this cancer treatment? So he's asking about the lung cancer treatment.
Yes, I get it. So this will be depending on the mode of treatment that will be provided for the patient and performance status of the patient before the particular treatment modality. For example, a young healthy person who is a 45-year-old age with healthy lungs have incidentally detected stage 2 lung cancer. So after appropriate investigations and staging of the disease, the patient will be uh, undergoing surgery and adjuvant chemotherapy or radiation depending on the pathological stage. After this treatment, after the completion of the treatment, as the patient performance status was good before surgery or before treatment, there are a lot of chances for him to improve as early as possible because surgery will not compromise the functional status of a person. Rather than we are removing a particular portion of the lung. As we discussed, there are like three lobes on the right and two lobes on the left. We are removing only like 20% of the lung in a lobectomy, and we have 80% of the lung that is with us. So these 80% of the lung will acclimatize to the situation and will compensate for the deficient lobe of the lung and improve the patient's condition. So, it, how long, as he asking, how long it will take, this will be depending on the stage of the disease and performance status of the patient before treatment.
Next question, Tanmoy Saha. He's asking, Sir, what are the earliest possibility symptoms of lung cancer? So we have already discussed it, but if you can repeat it
Yes,
again. Yeah.
yes, we can. Um, the earliest possibility means in say lung cancers nowadays there is post-COVID, especially we call it as pre-COVID and post-COVID. After the 2020, there are due to COVID, there are lot of CT scans which were done unnecessarily or whatever post-COVID. Any COVID positive patient will have to evaluate himself, or any doctor will be prescribing CT scan for him. So these chances had increased the incidental detection of lung cancers in a particular group of patients. So incidental detection of lung cancers is the main reason of catching lung cancers in earliest diseases, in earliest stages. Um, when we come to symptoms, symptoms can be like chronic cough, hemoptysis, chest pain, shortness of breath. These can be problematic for the patient depending on the size of the disease and location of the disease. For example, if the disease is in the main bronchi, the whole lung is completely blocked, and he will have symptoms as soon as the other lung uh, cannot compensate for the patient. He will have shortness of breath. He will have hemoptysis. He will have chest pain. But the other disease, the other location like peripheries of lung, if a disease is particularly in the peripheries of the lung, he will have more of chest pain rather than having cough and hemoptysis. So Depending on the location, the main symptoms can be cough, chest pain, breathlessness, hemoptysis, and the late symptoms like we have bone pain, headache, nausea, seizures, etc.
Next is Tandra Banik. ओके, अगर
Yes,
पेशेंट को लंग कैंसर फर्स्ट स्टेज में है तो उनको सर्जरी की जरूरत है.
exactly.
सो बेसिकली शी इज आस्किंग कि
Su-
इफ द पेशेंट
mm, yes,
सर्जरी
right.
फर्स्ट स्टेज कैंसर.
सर्जरी की जरूरत 100% है because catching, detecting lung cancer in stage 1 will give curative treatment for the patient. So, as we discussed, the 5-year survival rate for a first stage lung cancer patient after curative treatment, that is surgery, is 65%. So, if we catch 100 patients uh, of lung cancers, these stage 1 patients will survive up to the end of 5 years, like up to 65% of them will survive up to 5 years. So, in first stage, second stage, and third stage, even maximum cases of third stage also, there is a role of surgery, and they should go for surgery because surgery is the only curative treatment that can be provided to a lung cancer patient. Yes. Next.
Next is Baswati Chakraborty. What are the options for lung cancer screening? So I've asked the same question, but could you please, yeah?
Yes. It's me.
Yeah.
The same thing. The only option for lung cancer, which is best test, is a low dose CT scan, which will provide 90% less radiation when compared to the conventional CT scan. So, any person falling into the high risk group should undergo lung cancer screening.
Next is Mani Ramchandran. He is asking, having no smoking habits, no alcoholic, but affected lung cancer.
Affected lung
What is the
cancer, what is the reason?
yeah, yeah.
See, as we discussed, only 50% of the lung cancers are in smokers or any history of smoking or active smoking. The other 50% of lung cancers are in persons like without any smoking history but who are subjected to uh, second hand smoking or passive smoking, who had exposure to the environmental radiation, and having family history, first degree relative having lung cancer, environmental factors, or any history of cancer treatment undergoing radiation therapy, like any patient with breast cancer who had taken radiation therapy to the breast region uh, can have a lung cancer, and any patient taking radiation therapy for lymphoma can have lung cancer in the subsequent years.
It's like we have a lot of questions. So next question is Devajyoti Acharya. He's asking, sir, for
I think,
liver cancer, I think any food
I think,
restriction is there?
I think he wanted to ask for lung cancer because
Okay, I mean, yeah, lung
mm,
cancer, yeah.
mm.
Hmm.
For lung cancer, the only abstinence needed is from smoking. And there are during treatment also there are no food restrictions. There are restrictions in like only smoking. Apart from that, there is active care that should be taken towards the general condition of the lungs of patients, like doing breathing exercises, for example, spirometry before and after the surgery, having regular exercise will improve the general condition of the patient. As per se, there are no food restrictions for lung cancer patients.
Next question is, what is the surviving rate for I think he is
Anything.
asking about the lung cancer only, or maybe some other cancer. But we can discuss about the lung
I
cancer
think
survival rate.
surviving rate, as we discussed, the average worldwide survival rate for lung cancer is around 26%, but in India, the average survival rate is only 10%. But detecting lung cancers in early stages will improve the survival rate of the patients. For example, if we detect lung cancer in stage 1, there is 65% 5-year survival rate. If we detect in stage 2 or stage 3, there is only 37% of survival rate for the patient. But if we detect a patient in fourth stage with a distant metastasis, the survival rate is only 8%, which is way below uh, average.
Mm-hmm.
And this is showing that detecting lung cancers in early stages is more important to give curative treatment to the people, to the
Okay.
patients.
Yeah. I think there are no more questions. So, yeah, thank you so much, Doctor. Thank you so much for delivering such an interesting and insightful session for me and for our viewers. So, thank you so much. And audience, thank you so much for joining us. I hope आप लोगों को काफ़ी ज़्यादा लंग कैंसर के बारे में जानने मिला होगा. And if you ever need cancer consultation, so you can definitely visit Dr. Pavan Karella at CBCC Cancer Center, Agartala, and meet him and have a consultation or clear your queries. So, Doctor, any concluding remarks for our viewers?
Uh, Concluding remarks are the only thing. The main aim of this event is to create the awareness about the lung cancer, to let people know the risk factors, symptoms, and the treatment options available for lung cancers, to break down the myths of lung cancer. I think we had successfully done it and we had discussed in detail. I think thank you everyone. Thank you. Thank you for
Thank you
supporting
so
us.
much. Thank you so much, Doctor. Thank you so much,
Yeah.
audience, for joining us. Thank you. Yeah, bye.
Thank you.